Okay, I've had a chance to kind of mess around with my camera settings. I think this makes me look a little bit pale. I'm not really sure. Ashtray. Yes, it makes me look just a tad bit on the pale side, but I don't think there's too much I can do about it regarding I'm already naturally very, very pale. I wanted to talk today about some medicines that people usually get with treatment that have mental illnesses. The first thing the doctors say is medicine, 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 medicine. Now, I can honestly say from my experience when I was younger, at 16, the first thing they put me on was Zoloft. And Zoloft, not good with me. It wound up making me more depressed. I became suicidal. I tried to OD on them. It was really, really bad. And nowadays, you know, they actually have it all recommended that, you know, watch for suicidal patterns, strange behaviors and stuff when, you know, your close one is on any of these type of medications. Some of these medications, you know, they can work just great for you. You know, I know people who are on Zoloft and it works wonderful for them, for their depression and, you know, for the anxiety. Other people like me, in my case, it puts me through the roof and I'm completely psychotic, more or less. One of the medicines I was on before, I actually took a vase to my head. I beat myself in the head with a vase, and I have no clue why. I was roughly 17, not a clue why I did it, but it had to do with the medicine I was on. And everybody, you know, back then thought I was just, you know, completely nuts. And I was. And it was mainly due to the medicine. One thing you got to watch for is how many medicines the doctors are putting you on. Some doctors are willing just to push, and they're going to push a bunch of medicines on you. And that's not always a good thing. The medicines tend to make us, anybody who has a mental illness, they make you foggy, they make you tired all the time, and really, really, really drugged down. And it actually takes time to work through that to where you're actually feeling normal. With me, I'm going to pull out mine. Mine are in my purse because I just got back from the doctor's today. And they needed a lovely list of my medications, which is always so much fun. Like with me, I take Seroquel, and I take 100 milligrams in the evening. Now, I did not start off with this dosage. I started off with like 25 milligrams, and it gradually got increased to keep my mood stabilized, because that's what the borderline personality disorder is. You get intense interpersonal relationships. You get, you know, you get the mood swings. I'll go into another video one day and I'll explain it just a little bit better. But this right here is what I take, and I take this in the evening. And I also take 50 milligrams in the morning, and I take 50 milligrams probably about 3 o'clock or so. And it can drag you out. It can make you really, 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 really tired. But it doesn't always stay like that. So if you get put on medication and at first you're really tired and everything, give it some time, let it work into your system, and see how it goes after that. If by a month you're still drug out, then re-talk to your doctor, obviously. But every one of these medications I recommend to anybody to please read the side effects. And also read withdrawal effects for if you're trying to come off the medicine. 1 second. I know I'm so addicted to the smoking. It's really, really bad. I should not be doing it. I will continue to say I will quit one of these days, and you'll see a video say I quit, I did it, you know, I'm not gonna smoke no more. One of the other medicines I know that I was tried on was Celexa, and that's a well-known name, and it's for depression, and I believe also for anxiety. And they first put me on that back in 2011. I didn't respond so well the first month. That's how this all happened. The cutting. I don't even know why I did it, but I took a knife to my arms, and I actually took one to my wrist right in here. And I wound up working through it, and I wound up being okay, and I stayed on it, but it wound up causing a weight gain. I went from 125 pounds to 160 pounds. Now, that right there will make a woman depressed. It'd probably make anybody depressed. So that got me very concerned about my weight. So I talked to my doctor about weaning off and getting off the Celexa. When I first went to get off of it, and, you know, when I finally got to where I stopped taking it, I was getting really, really bad dizzy spells. I was nauseous. My head was foggy. I just felt really, really sick and achy. It was really, really, really terrible. I felt like I was losing my mind while I was coming off of this stuff. Apparently it has a very, very bad withdrawal side effect. So people who are on it for extended periods of time, it's not so well to come off of. It's not a medicine I would personally recommend for anybody who just needs it for short term, just because of the side effects from the withdrawal. You know, and I learned some different interesting little factors about things like Seroquel. Like, I read different articles, Seroquel itself. There's been people that have taken Seroquel and did not wake up. They died. Why? They don't know. Let me go through some of the side effects. And, of course, I always pull up my little handy-dandy computer for all this, because I literally do not remember it all. Let's see. Well, let me do Celexa first. Celexa side effects. And, of course, one of the side effects to watch is going to be for, you know, the suicidal, agitation, higher anxiety levels, you know, a change in the personality. Like, most of the times the person taking the medicine might not realize it. So if you're a family member, you know, a boyfriend, girlfriend, you know, anybody, when you start noticing this stuff, immediately bring it to that person's attention, because more than likely they're having a really bad side effect to it that you don't want to go there. Let's see. Celexa uses in side effects, which it's also called citalopram, by the way. It treats depression. Where are your side effects? Sometimes it's so much fun to try to get to the side effects on this stuff. It's ridiculous, because they'll always list everything that it's for, but you really have to go to the side effects. Alright, contact your doctor if you experience any of these side effects and they are severe or bothersome. Abdominal pain, agitation, anxiety, diarrhea, dizziness, drowsiness, dry mouth, fatigue, fever, heartburn, increased sweating, which I did have that. I would go to bed and I would wake up covered in sweat. It was like I was having hot flashes. Increased yawning, loss of appetite, nausea, painful periods, sexual difficulties, shakiness, sore throat, stuffy or runny nose, trouble sleeping, vomiting. Them are just like some of the little ones. And then it gets to the bigger ones. Behavior similar to drunkenness, bleeding gums, blurred vision, confusion, dizziness or fainting, which I did have. I was blacking out and I would faint. Increase in frequency of urination or the amount produced. Trouble holding or releasing urine, irregular heartbeat, lack of emotion, loss of memory, which I did have loss of memory, and I still am having loss of memory. Menstrual changes, mood or mental changes, and that's where they say that's where your negative side effects can come in, because it can actually, you know, change your mood and how you think. Nervousness, nosebleeds, purple or red spots on the skin, that doesn't sound good. Severe agitation, severe migraine, skin rashes, slower irregular heartbeat, sore throat, fever, chills, trouble breathing, unusual or sudden body or facial movements or posture. Stop taking the medication immediately if you get chest pain, seizure, or convulsions. Another thing is serotonin syndrome. It's sometimes if you're taking too much of an antidepressant, or you're taking more than one, you have a higher risk for serotonin syndrome. And I'll read that off what that is. But signs of it include agitation, confusion, diarrhea, fever, overactive reflexes, poor coordination, restlessness, shivering, sweating, talking or acting with excitement you cannot control, trembling or shaking or twitching. And then you got thoughts of suicide or hurting yourself, which that can happen on any of these antidepressants. It's a risk always. with me, the doctors have to actually watch what they put me on, because most of them, I've already tried Paxil, Wellbutrin, Wellbutrin XL, Zoloft, the Celexa. I'm always having these negative side effects. I don't get the positive side effects from it. Actually, Celexa, you know, other than when this started happening, it didn't really faze me. Like, it didn't cure, it didn't help my depression. I was still depressed. And, you know, but most of my depression goes environmental, of anything that's happening around me. You know, or if somebody's putting me down, or, you know, I have issues with my mother sometimes, and, you know, if me and her get into a fight, I get really, really, really upset, and it's very, very intense for me. So that's what usually brings that out in me. I don't normally, you know, get depressed for no reason, other than, you know, about my looks. I'm very self-conscious because of the trick in my teeth. Now, yeah, they even have a Health Canada advisory with new restrictions on citalopram. They can cause bleeding disorders, diabetes, heart disease. It can mess with your kidney functions, liver functions. It can cause seizures, suicide or agitated behavior, which you'll see that in any of the antidepressants. Wow. But yeah, there's a lot of different things. But when you go to the withdrawal side effects, and this is something we don't usually look up when we, you know, get on the medicine, we try to trust the doctors. The doctors never told me about the withdrawal side effects. They gave me Celexa after my miscarriage, just to help with the depression part of it, because I was 18 weeks pregnant when I lost my baby. And, you know, it wasn't something that I was supposed to permanently stay on. At that time, we weren't even certain that I had borderline personality, so I wasn't on anything else. Dosing, drug interactions, side effects. We already know the side effects. Where's your withdrawal effects? There are whole pages on this too. SSRI, discontinuation syndrome. This is actually on the Wikipedia. Is a syndrome that it can occur following the interruption, dose reduction, or discontinuation of SSRIs, selective serotonin reuptake inhibitors, which Celexa is one of them, or SNRI, antidepressant medications. The condition often begins between the time of reduction in dosage or complete discontinuation. Never, ever, ever, if you've been on a pill for a while, just up and stop taking it, because you will regret it. It will be very, very, very hard. I've heard people say that coming off Celexa can be as bad as coming off heroin. I've literally heard a lot of people tell me that. I had it rather easy compared to what a lot of other people could have had. Interruption, cessation, or reduction of dosage in the SSRI treatment that has lasted 4 or more weeks. Symptoms which interfere with normal social, occupational, or other functioning, are not due to another medical condition, and are not due to relapse to the condition for which the SSRI was originally prescribed. Neurological symptoms described as brain zaps. It's like a little zap, you know, like you're getting shot with. I did not go through that. I've heard of other people who have, though, and I've heard it's really not pleasant. Brain shivers, brain pulse waves, head shocks, pulses, flickers, or cranial zings are withdrawal symptoms experienced during discontinuation or reduction of dosage of antidepressant drugs. These results from a global downregulation of serotonin response to increased levels of serotonin in the synaptic cleft. I'm sorry if I pronounced some of this wrong. I'm not really good with pronunciation with some of the medical terms. Common responses to dose reduction or cessation include dizziness, electric shock-like sensation, sweating, nausea, insomnia, tremor, confusion, nightmares, and vertigo. There are a lot of different ones. So anytime a doctor prescribes you a medicine, the first thing you need to ask is, okay, what are the side effects? What do I need to watch out for? And if I ever decide to discontinue this medication, what are going to be the withdrawal symptoms? How bad are they going to be? I made the mistake of not asking that when the doctor gave me Celexa. You know, she just wrote it off and said it would help with the depression. And, you know, that was that. You know, and just kind of watch out for these side effects, which I already knew to watch out to make sure I didn't go crazy, more or less. I did not have a clue about the withdrawal symptoms. So I figured I would get a video out there explaining a little bit of this. I don't know how much of it really gets talked about. People who do not have mental illnesses and do not have to take these medicines, I hope they see this, because we actually go through a lot. The ones, when we're taking our medicines, there's reasons there's a lot of us that do not want to take them. Because overall, they don't always make us feel good. They don't always make us feel better. Sometimes they make us feel worse. Or, you know, we have to deal with these withdrawal symptoms. Or you got to deal with severe dry mouth. And you're drooling because your mouth is so dry. Or you're so spaced out that you just cannot function. All you can do is sleep. Them are always the side effects that we end up having to deal with. And it's whether you have anxiety, bipolar, borderline, any of this. You always have to watch out for the medicines. That is always top priority. You know, don't always just trust what the doctor's saying. They're saying, okay, well, here you go. This is what you need to be on, you know, and this is the dosage. First, watch out the dosage on what they're putting you on, because they shouldn't start you on an extremely high dose to begin with. They need to wean you up on the dose. The second thing is, always ask about these side effects and everything, because, you know, you need to know this. You know, and if they're not going to answer you, the pharmacy will answer you. And ask the questions. Have like a list written out of the questions, you know, that you want to ask. That way you know when you get in there, this is what I want to ask. This is what I want to know about the medication they want to put me on. And I want to know how it's going to affect me in my life. I want to know if it can cause, you know, me not to wake up. Or if it could cause me to have a seizure. You know, this is all stuff that we want to know, that doctors don't usually just up and disclose to us when they give us the medicines. And, you know, people like me, I'm so trusting, you know, I just trust they're giving me the right medicine. They know my medical history, and that's that. And it doesn't always work like that. So just make sure you're aware and be careful. And, you know, hopefully everything will end up working out really well for you.